What are some examples of social stigma? When we talk about social stigma, especially in the context of substance abuse, it is important to understand how it affects individuals and their ability to seek help. So, what are some examples of social stigma that people face? First, many individuals who use drugs are often labeled as weak or immoral. This perception overlooks the fact that addiction is a chronic medical condition that changes the brain. Instead of compassion, these individuals face judgment. Another example is the use of negative language when discussing substance use disorders. Words that imply shame or judgment reinforce harmful stereotypes. This kind of language can discourage people from seeking the help they need. People with substance use disorders are sometimes seen as dangerous or untrustworthy. This leads to social exclusion and isolation, making it even harder for them to connect with others and find support. In healthcare settings, discrimination can occur as well. Individuals with substance use disorders may receive lower quality care or face bias from healthcare professionals. This can deter them from seeking medical help, worsening their situation. Social rejection is another painful aspect of stigma. Friends, family, and even employers may distance themselves from individuals struggling with addiction. This can result in loss of housing, jobs, and social networks, leaving them feeling even more alone. Fear of judgment or legal consequences can also keep people from being honest about their drug use. This fear can prevent them from seeking help, which increases the risk of harm and makes recovery more difficult. Some individuals internalize this stigma, leading to feelings of shame and lowered self-esteem. This self-stigma can decrease their motivation to pursue recovery or treatment, trapping them in a cycle of addiction. Additionally, racial and ethnic minorities often face compounded stigma. They may encounter extra barriers when trying to access treatment, making it even harder to get the help they need. These examples show how social stigma not only harms individuals with substance use disorders, but also creates barriers to effective treatment and support. Addressing stigma is essential for encouraging people to seek help without fear of judgment or discrimination. By changing public attitudes and using respectful language, we can create a more supportive environment for those in need.